Hi, my name is Thomas, and this is a video demonstration about how to give an IV med via CIVA. So right off the bat, we will take our drug that we pulled from Pyxis, it's hydrocortisone, and we'll do our first check. So we have Emma Wrightson as our patient, no known drug allergies. The drug is hydrocortisone, 150 milligrams is the dose. We have 250 milligrams in here, so the whole dose is in there, and we'll be giving it IV via CIVA and Q4H, and it hasn't been given yet, so at the right time, and that's good. So right after that, we will head over to our monograph and take a look. So hydrocortisone, it's a corticosteroid. We're giving this to our patient because of adrenal insufficiency, and it may be administered by a nurse or a student nurse, and so that's good. The usual dosage is 100 to 500 milligrams every 2 to 6 hours, and that's we're right at the lower end of that. The maximum single dose, 1,000 milligrams. Under that, the maximum daily dose, 2,500 milligrams, and we're under that. So for reconstitution, we have a 250 milligram vial. We're going to be putting 1.8 mils of water in it for a final volume of 2 mLs and a final concentration of 125 milligrams per ml. Other than that, the maximum concentration is 125 milligrams per ml, and we're going to be well under that because according to the CIVA page, we're going to be putting our dose of 150 milligrams in 10 mLs of, so we'll be diluting it into a 10 ml syringe, and we'll be giving it over 26 minutes. As far as compatibility, it's compatible with normal saline, D5W, and D5W normal saline solutions, which is what we have running on our primary for a patient. So that is all good. So to start off, we're going to reconstitute this med because it's in a powder form. So according to our monograph here, because we have the 250 vial, we're going to be putting 1.8 milligrams of sterile water in it. So we're going to open this up, butter vial, make sure that it's sterile. This is our 3 ml syringe. We'll get our sterile water out there, and we'll put our blunt fill on, keeping that sterile. Okay, and now we'll take an alcohol swab. We'll pop this off because this is new. And we're going to swab both the sterile water vial and also the actual drug vial, just because we're going to be going back and forth pretty quickly. So we'll clean this for 30 seconds, let it dry for 15. We'll say that that's happened just to keep this video short. And same thing, 30 seconds, dry for 15. Okay, and now we're going to be taking 1.8 mLs of water for injection here. So we'll put that much air into our vial there, 1.8. So that's been cleaned. We'll inject the air. And we'll make sure not to touch the needle or anything as we get our bubbles out here. Okay, and there we go. Back on, and we can just show here we have 1.8 mLs of sterile water. And okay, so this has stayed clean. If there was any suspicion that it has been contaminated, we'd clean it again, but there isn't. So we will be putting that into our drug vial, inject that, and we're going to take out the amount of air that we put in just so that it's not very pressurized. So we take out 1.8. This, and now we will just turn this to make sure that the medication is dispensed evenly over the liquid, because we want to be giving it as evenly as possible when it's in the CIVA machine. Okay, so we did our drug calculation earlier, and we determined that we're going to be pulling up 1.2 mLs of this reconstituted drug now, because that'll give us our dose of 150 milligrams. So we'll get our air to 1.2. We'll be injecting that into our vial, and we can just double check really quickly that it's not cloudy or anything, and this has stayed clean. If it hadn't, we would clean it again. So we'll inject 1.2 mLs of air. And there we go. bubbles out, pull back. Okay. And so you can see here that we have 1.2 mLs of our drug in there. Okay, so we'll put this off to the side for now. We'll come back to it, and now we'll take our 10 ml syringe. So because we're wanting to administer this drug in 10 mLs, we're going to be putting 8.8 mLs in here to make this, what we've already drawn up, the 1.2 into 10 mLs. And we're going to just be using normal saline for that. So we'll get another blunt fill ready here. And we'll open our 10 ml syringe. Over there. And that. Oops, the cap is still there. And we'll just make sure, and so if that had folded over, which it didn't, we would grab a new one, but it didn't, so we're good. We'll pull back and we'll get 8.8 mLs of air in here. Okay, and before we do that, so we've got to make sure that we clean this vial. So we'll clean this for 30 seconds and let it dry for 15. And we will inject our air. Popped out there, that's fine. Just put it back in. Okay, just get our air bubbles out there. All right, there we go, and we'll cap this. And we can just show here that we have 8.8 mLs of normal saline. Okay, so now before we go any further, we'll just do our second check here. We have a label made for our meds, so we have the right patient, amorixin, the right drug, hydrocortisone, the right dose, 150 milligrams, and that's in 1.2 mLs, that's still good. The right route, IV, and we're gonna be giving it Q4H, and it hasn't been given yet, so that's good. So what we'll do now is we'll pull back on this syringe because we're going to be putting this drug in with our, with the normal saline that we've drawn up. So we will take off this blunt fill, we'll uncap this, and we will just inject our drug into there. And now at this point this needle can go into the sharps because we won't be using it anymore, it's empty. And we're going to push up here, double check for air bubbles, there are none. That's good, okay. We'll just put one of these blue caps on for the time being, and that will keep it sterile. So we can see here that we have 10 mLs of our drug here, and this is what we will be putting in the CIVA pump. Oh, sorry, I might have covered that. I'll just show again there. 10 mLs. Okay, and we'll put our label on it. And so we've done our second check. We have our drug in there, and we, oops, that's upside down. Like that, and we will now go into our patient's room with our supplies, which we've collected here. Again, these needles would be in the sharps, etc. Okay, so we'll Go into our patient's room, knock knock. Hi there, my name is Thomas, Mrs. Wright, and I'm a student nurse. I'm going to be giving you your hydrocortisone. It's just for your adrenal insufficiency. So after we give this drug, you might experience some like headache or dizziness or vertigo, etc. So just inform them of the side effects. Does that sound good with you? Okay. So we will just check the IV sites for any swelling or coolness, and it looks good. No pain there? Okay, perfect. And we'll take our MAR, and we can also take our label there, and we'll check the patient. Emma Wrightson, Emma Wrightson, Emma Wrightson. Okay, and can you tell me your name and your date of birth? All right, perfect. So we have the right patient, the right drug, hydrocortisone, 150 milligrams, 150 milligrams. We're going to be giving it IV, which is good, CIVA, and it's every 4 hours, and it hasn't been given yet, so that's good. Before we also start, it's important to check our primary here, and so the physician's order was for it to be running a TKO, so it's at 30 mLs an hour, so that's good. And we can just check the lines before we start here. It doesn't look like there's any air bubbles. We can check the label on this line. It's good. Yeah, all the clamps are open, etc. Okay, so what we'll do now is we have our micro tubing here, and we're going to be just priming this first. It's slightly tangled, it's okay. It has caps on it, so the ends will stay sterile. So what we can do now is just loosen this first so it comes off easier. Take off here. This we want to keep sterile because the medication will be flooding through there to the patient. So we'll screw that on, and now we want to prime it. So we're going to slowly just push the medication through this way. You can kind of see we're going to be watching for air bubbles while we do it. And then just once it gets to the end there, that's good. So our line is primed, there's no air in it. And so at this point, we can connect it to the patient's line. We're going to be using the first port after the pump, just so we can leave this one open for if the patient needs any IV push meds. So we'll open our alcohol swab, and we will clean this for 30 seconds, let it dry for 15, similar to the vials that we had. We'll make sure that that stays sterile. We will open up this, make sure that we're, again, keeping everything nice and sterile, and we'll just twist that on there. Okay, so that's good. What we'll do now is we will open up our CIVA little syringe holder here and slide that in there. Just want to make sure that it's clicked in properly. Yeah, that's good. Okay, and so according to our CIVA chart, we're going to be giving it over 26 minutes, and we can see there, this is 20, this is 25, and it's just a bit above that, so 26 minutes. So that's good. We're all connected there. We can just double check the tubing for air. It looks good. And then so what we'll do now is we'll just hit the start button to start at normal speed, and to make sure everything's good, we'll watch for that green light there. So that's good, so that'll infuse. Because this is the first time that the patient is getting this medication, I'm going to stay and just watch for any adverse reactions or hypersensitivities, even though the patient says that it has no allergies. Just best to be safe. And so we'll let this infuse. It'll take 26 minutes. And at the end of it, we'll come back with a 3 ml flush. We'll flush the line just to make sure that the patient gets the full dose. And other than that, we can do our exit safety check. We can just double check all the tubes here. We can also label this line here for us so that we know when it was hung, because it'll need to be changed at some point. So we'll just put that on there. And that's got the date, the time, my initials. So all the lines look good. Can I get you anything else? No? Okay, we'll raise those side rails. And we will document that we've given the medication. Like I said, we'll be back to flush it in a little bit. And other than that, yep.